These are the different specialties in dentistry that once you go through this course, you might want to venture into. So apparently there's 8 specialties, but sometimes they'll add others and say that it's a specialty. So we're going to go through each one like our textbook says. General dentistry is the first step in becoming a dentist, okay? It's 8 years total of school. The first 4 are your bachelor's degree in science, biology, whatever you want to major in, whatever's required by that certain school to become a dentist. Okay, so they might say, well, you have to take this amount in chemistry, this amount in biology. So you want to make sure you know that with the dental school before you apply. So the first 4 years is a bachelor's in science, and then the last 4 years would be strictly dental, okay? So when you look at it, 8 years seems like a long time, but it's really just 4 years of regular college, and then the last 4 would be a class like this for 4 years. And that's fun, right? Because you're learning specifically what you want to be when you finish, correct? You're also doing community stuff, so VCU has Mission of Mercy. Powhatan Dental Outreach Foundation does free clinics for children. So you're actually doing what you love, okay? So try not to look at it as 8 years of college. It's 4 years of college, 4 years of what you want to do with the rest of your life. Now, what does a general dentist do? What is their job? It is seeing you every 6 months for preventive care to make sure that if they see a small cavity, it gets filled before it becomes a big cavity, okay? So their main job is to keep your mouth healthy and to see you every 6 months. Oral and maxillofacial surgeons will go to school for 8 years, 4 years bachelor, 4-year dental, and then 2 to 4 years of a residency. Their work consists of extractions, typically on difficult extractions, like a third molar that's laying sideways and it's bumped up against the second molar, or it's close to the mental foramen and they don't want to hit that nerve and cause the patient to be paralyzed on the chin. So if a dentist can pull teeth, but if it's something that is questionable or might be difficult, they're going to send them to a specialist. They also work with the orthodontist. So if I have a really recessed chin and I want to make it longer, they can do surgery to extend the jaw to line the teeth up, okay? And they can do surgery for functional or just cosmetic, okay? They can add chin plants and things like that, just to be aesthetically pleasing. An orthodontist, this was the specialty I went into and absolutely love. 4 years of school, 4 years of dental school, 1 to 2 years of the residency, depending on what state that you're working in. And whatever state you're working in, if you're a dentist or a dentist with a specialty, you have to take the written and the clinical in order to be licensed in that state. And so what an orthodontist does is straightens the teeth for either functional reasons or cosmetic reasons. You might have all of your teeth are in alignment and functionally they're perfect, but your upper right central sticks out a little bit and you just want to pop it back into alignment. Functionally, it's not bothering anything, but cosmetically it bothers you. So for orthodontists, their job is to straighten the teeth for function or cosmetic, and it helps to build your patient's self-esteem. In there, it's not just braces, it's also different appliances. So you have a headgear on the lower right, and you have an expander that you actually turn to expand the jaws. And so there's a lot of physics involved with it for this particular job. And then you have dental public health. So that is the Powhatan Dental Outreach Foundation that goes to Honduras. They do free dental clinics for children, and underneath is where they went to a local school and did 504 free cleanings and fluoride treatments. So dental public health is very important, and it helps patients that can't always afford dental care, or they don't have insurance to cover some of their dental care. Endodontist, same thing, 4 years of bachelor's, 4 years of dental, and then they go into their specialty. But what do you see in this picture? You see the tooth that looks like it's cut in half. A lot of people think a tooth is solid white, like it's a big chunk of calcium, but it's not. It actually has layers like the earth. You have the crust, the mantle, and the core. And it's designed the same way. You have the enamel, the dentin, and then the pulp. So the enamel, like the crust of the earth, is very hard. Then you get down to the dentin, and it's a little bit softer, like the mantle. Once you dig up that initial dirt, it's pretty soft. Then you get to the center of the earth, and it's liquid, and it's very warm. There you have the pulp and the center of the tooth. It's liquid, it's blood and nerves and tissue. And so if that becomes infected, you have to get it out. So you drill a hole down the center of the tooth, and you gain access to the pulp by using these reamers and files, and you clean it out, and then you pack it with gutta percha, which is a plastic material, and then you seal it with a filling, and then put a crown on top of it if needed, okay? So an endodontist's main concern is the pulp of the tooth and making sure it's healthy. If it's inflamed, they might prescribe antibiotics or do some type of therapy on it. If it's necrotic, dead, you got to get it out of the body, right? So they clean it out, and then they make that tooth whole again. Perio refers to tissue, so a periodontist would be the type of dentist that you go to for gums. Up there on the left, you see a healthy pink tissue that's holding that tooth. The more inflamed and the more diseased that the tissue becomes, it starts to pull away from the tooth, and food gets packed in there, bacteria gets packed in there, and it just keeps moving it away until there's no gum support, and that tooth just comes right out. So making sure that your gums stay healthy and pink and don't get to this part is very important. You would have to treat that patient with antibiotics. You would have to do their mouth in quadrants. We learned about the quadrants, how you have the upper right, the lower right, upper left, lower left. You would not want to try to treat this patient all at once, okay? That's a lot of dental work in one sitting. So this is what a periodontist does. They also do surgeries like gum grafts, where my lower teeth, my gums were receding, so they had to take tissue from the roof of my mouth and transplant it down to make sure those teeth were covered and had a good tissue support. Pediatric dentistry is always fun, but if you don't have the personality and patience for it, you don't want to do it. So this particular dentist, they see typically ages 18 and under, and it's making sure that their mouths stay healthy and they're losing their baby teeth on time. If they have to lose them early, then you have to hold that space so that the permanent teeth will have room to come up. So for pediatric dentistry, you want to make sure that everything's erupting on schedule, that the teeth are clean, there's no cavities, because a cavity in a baby tooth, if it goes long enough, can actually infect the permanent tooth below it. So pediatric dentistry, absolutely love working with kids, but if you don't have the patience and you can't see kids cry and go through getting shots, it would not be for you. Prosthodontics, you've heard of someone having a prosthesis. You know, if they lose their leg, they have a prosthetic leg. This is just in a smaller area. You lose your teeth, you can have fake teeth, okay? Such as implant dentures, removable dentures, a removable partial. And so when you have these appliances that you can take in and take out, the prosthodontist sends these to a lab if they don't have an in-house lab, and they take the impression, just like you guys took the other day, pour it up in a model, and then they build it on that model, and then once it's done, it fits perfectly in the mouth, okay? And this helps restore function, because if you lose half your teeth, it's gonna be hard to chew. So this whole purpose is to restore it to good function so you can eat properly and speak properly. All right?